Okay, I think Amanda, we can go ahead and just get started, and we are recording today's session, so it'll be available on our YouTube page. But
Okay,
in the interest of everyone's time, we'll go ahead and get started.
sure. So, welcome everybody. My name is Amanda Bittenbender, and I am with the America's Choice team here today. So, just to be clear, would you like us to do a little overview of our products, of the platform? What kind of training would you like us to go through, just so that we're making sure we do assist you guys the best we can?
Sure. Actually, this is a new product for Insurance Advisors Direct. So if you can give a little overview on America's Choice, and then just about the products and anything that you have that you can share with us as far as the portal, but and particularly the products are very important since this is new for everybody here that's on today.
Okay, perfect. Sounds great. Well, again, welcome everybody. And today we'll do a little bit of an overview of America's Choice. I have some team members with me as well who may assist in just showing some of our products, but a little bit about a background on America's Choice. We are a newer product to the market. We do serve as an ACA compliant product, and we have some items that qualify an individual to fit into our products. So again, this is a health benefits plan. ACA compliant might be a little bit different than if you're used to maybe selling Medicare or any other ancillary products. But again, a medical insurance product. And we carry 13 different plans. So we have three limited medical plans, we like to say, and then we have 10 traditional major medical. Three of those 10 are also HSAs. So we'll walk through a little bit of the plans, also what they entail. Usually our co-founder, Stephen Tucker, is here, and he typically will do a little bit of the plan presentation. So if there's any questions that I cannot answer or my team cannot, we'll make sure that we take those down at the end of the presentation and get those back to you guys if we cannot answer them. So again, a little bit about America's Choice. Stephen Tucker has co-founded it with another individual, Gavin Quinnis, and our health plans are not only compiled of a health plan, they also have a wellness portion to the plans that each member gets to utilize. And with those, again, we have 13 different plans. And we have the individual market right now, where our network of choice is PHCS RBP. We are launching additional PPO offerings later in 2024. So that will be exciting as we bring on more options for clients. And through the different plans that we offer, I'm not sure, can one of my teammates share their screen? Can we give Crystal access to share the screen to bring up one of the plans? Okay.
Mm-hmm.
So Crystal, if you want to share maybe the limited medical plan first, or annual plan. Yeah, let's start with the annual max plan. Okay, perfect. Here we go. So that everybody knows, we have three annual max plans. We have a 100,000, a 250,000, and then a 500,000 annual max plan. And with our plans, there's three criteria that an individual fits into our plans. Okay, so before we dive a little bit more into each of the plans, our three criteria is we have age bands on our plans. So individuals from ages 18 all the way right before their 63rd birthday, so they have to be under the age of 63, so they could be 62 and a half and so forth, that they fit that age band. So they fall into our age category. They have to answer 11 medical knockout questions that we can go over a little bit later. And those questions pertain to the individual enrolling and then also any of their dependents. And so some of those questions, just to give you a brief idea, is, are you currently hospitalized? Are you currently pregnant? Are you a type 1 diabetic? And so forth. So to give you guys a little bit of an idea, we'll come back to more in depth on the questions. And then the third component, super, super important as well, as the members attest to this, that they are some sort of 1099 business owner. So whoever that 1099 business owner is, let's say in a family, if it's one spouse or the other, whomever that is, they're the main account holder on the America's Choice plan, and then their dependents can be spouses and children and so forth. Or if they're just employee only, employee spouse, whatever the case may be, they have to fit into the age bands. They have to be able to pass the 11 knockout questions, and then they have to be a 1099 business owner. And again, that can range. Maybe you have a at-home business, an Etsy business, a lawn cutting business, right? Or maybe you're a little bit more where you have a landscaping business, or whatever the case may be. You have to somehow fit into that criteria, and you attest to that as well when going through the application phase. So when we look at those criteria and we look at our plans here, again, starting with this 500,000 annual max plan, again, the network for our plan currently until later in this year, or just for our RBP plans, is the PHCS network. So with these plans, there's going to be an annual limit, and then there's a lifetime limit. So the member has up to $500,000 in annual benefits that they can utilize. And then throughout the life of the policy, they have 2.5 million. So if they get to that 2.5, then the policy would end and they would need to go seek other coverage at that time. Super important about our annual max plans is there is not a deductible. So you can see that pretty straightforward here, not a deductible, but there are various co-pays that members utilize throughout the plan. Super important as well with these plans, with the 3 annual max, that they try to go in network. We do have provider searches that utilize, so when you're with a client, seeing if this is a product that would fit their needs and fit what they need, need in healthcare coverage, you could say, utilizing a provider search to see, are there doctors in network, or what doctors could they go and see. So going in network, super important. If they do somehow go to an out-of-network facility, they may be paying a little bit higher on that appointment or that visit per se, because of going out of the network. Scrolling down, we do have various co-payments for different visits. So each member on the plan can utilize 10 visits per year of the different specialties listed. So $50 copay per visit. And let's say they see the primary care for 1 visit. Then they go see a specialist for 3, cardiac rehab or so forth. Again, they get a total of 10 visits per year on this annual max plan. You can also see urgent cares listed there as well too. As for telemedicine, we have just rolled out a brand new telemedicine. So some of our brochures are going to be changing. Well, they're not going to be, or some of them, they are all going to be changing by the end of this week. Our telemedicine that we have rolled out is a $0 copay. So that is very exciting for your members, that they no longer have a copay, and that they will be able to go ahead and schedule visits and so forth, utilize it to however degree they may need it. If you scroll down to preventative services, all of our plans across the board cover these preventative services 100%. So when we see that 100% of allowable, we're talking about the plan allowable and what fits into that category. And so when we look at that, again, going and seeing a doctor in network, if they go out of network for, let's say, a physical, they will negotiate a price and pay for if they went and saw that physician in network, and then the client will have to pay the remainder. But we see different preventative services. There's also an additional link. You don't have to click it, Crystal, but we do cover the 64 essential or minimum essential coverages as well within all our plans. And where it says click here for a complete list, you guys can go ahead and you can see a further list of the different services that fall underneath that category. Scrolling down further to the different, say office visits. Again, they would pay their copay, $50 to go see that primary care physician. Again, if they're in network, it would be covered. If they go out of network, they may be paying a little bit higher cost here. Going down to outpatient services, we have different copays per visits. So we're looking at lab, we're looking at x-rays, MRIs, and so forth. So we see our copays, and then we see the max that each member on the plan can go to in a single year. One of the key points I'd like to point out about surgical services is all of our plans, not just the annual max, our traditional medical with HSAs, you do need a pre-certification for surgeries and some additional components. And so through our Care Guide advocates, you can obtain that pre-certification for certain services. We have that listed, what would need that. And so a surgery is one of them. So they will go ahead and they will pre-cert that surgery beforehand. Now, if we go into an emergency, okay, so if we scroll down, again, we see our copays listed there, and we get a lot of questions from individuals. They're on their way to the hospital, and do I need a pre-certification? No, if it's a true emergency, you do not need a pre-certification, okay? And so one of the big things here is the only difference kind of in our plans is the ambulancing services. So there's 2 transports per plan year. So if you have a family of 4, that family gets 2 for the entire plan year. Okay, they don't get 2 per person. That is just 2 for the entire family or all the members on the plans. So again, we have our copay listed, and then going to an emergency or understanding that it's a true emergency. I don't need a pre-certification because I fell off the ladder at home and I broke my arm. I need to go to the hospital, right? And get that surgery taken care of. If you'd like to scroll down to inpatient hospital. So again, inpatient, okay, if they're coming for, let's say, a mental health or some type of surgery that they're going to be spending a little bit of time, they would need a pre-certification. You can see the different copays there, as well as the limited to the hospitalizations in a plan year, as well as surgical services. We do have maternity as well. So under our maternity, we have copay and C-section, and then what we cover for after that. And so super important here is, again, if they go to that in-network doctor for their maternity services, they are going to be covered. If they go to an out-of-network, they're going to be paying a little bit more. One of the key components to these plans as well is currently we do not cover dependent daughter pregnancies. So if you have a child on your plan, since we know that children can stay on health insurance plans till the age of 26, and they become pregnant while still on their parents' plan or their guardian's plan, then that pregnancy would not be covered. This is something that they are looking to change within our plan year. I'm not sure if it's going to be launched later in 24 or for 2025. So just pointing that out as well. We do have some mental health care services, inpatient as well. Again, you can see a copay, you can see a 10-day limit stay here. We have cancer treatment services. Now, super important here that when we go through the 11 questions, we don't currently take somebody who has cancer. Okay, so if they actively have cancer, they couldn't come on their plan. Well, let's say that they're on our plan, and then 3 years later they get cancer. These are the benefits that are within the plan. So just kind of being conscious of that, seeing what would be covered down the road per se if one of your clients ended up having cancer and then needing treatment. We do cover, again, some substance abuse services. Again, we don't take someone who's actively maybe in a rehab facility being treated for, but again, you never know, maybe down the road they need to go and seek help for a substance abuse problem. Again, different copays there and limits per member. And then we have additional information and copays for, let's say, allergy shots, hospice care, skilled nursing. Again, we don't take individuals who are currently on hospice care, but again, maybe they're on the plan and they end up needing it down the road, as well as some of these, or most of these actually, so hospice care, durable medical equipment, prosthetics, they would all require pre-certification. So within our plan documents, for all of our plans, we do have it listed per that plan, what needs a pre-certification, more in depth of inclusions and exclusions for the plans, and a little bit more information. And then if you scroll down a little bit further, we do have different RX benefits for each plan. So our annual max plans of the 100,000, 250, and 500,000, along with one of our high deductible plans, the 7350, they use the America's Pharmacy source. So this entails a $0 copay for their prescriptions that are on the formulary. So you under the APS formulary, there is a hyperlink there where you can go ahead and you can see the different medications that would be covered. We do tell agents and brokers that it's super important that they utilize that formulary when they're looking for a plan to put a client in, right? Want to make sure that, is their medication they're currently on, if it's a cholesterol or if it's a hypertension medication that, would it be covered? What would be their copay? We have two pharmacies, the APS and then also Medalist. So sometimes certain individuals need to go on a Medalist because of the medications they're on. So within our brochures and information, you do have the access to see what medications are covered there as well. And then if you scroll a little bit further, I'm not sure if we have our specialty. Okay, perfect. So you can stop right there, Chris. That's great. So we have our pre-certification disclaimer here, and then above that, we do not cover specialty medication. So when you're looking at that APS formulary and you're looking at the Medalist, taking a look at, okay, what is covered, and if it's not on that formulary and it's considered a specialty medication. So right now we see a lot of weight loss medications. That's really big in the market, right? An Ozempic or a Mounjaro or other different types of meds. They might not be listed on the formulary, or they might be listed as a specialty. So that client of yours would have to go through what we call a pharmacy importation program or an assistance program to possibly get some of that medication covered if not listed on the formulary. When you look at the premiums, again, this is just for the 500,000. The annual max plans are not age banded. So when we go to a major medical, we'll show you those different age bands, but for an entire family for a month, they can be covered for $929 on this, and then each have that 500,000 annual max benefit. So this is just giving you guys kind of a glimpse of what our annual max plans cover. Crystal, if you'd like to go to the 2,500 gold, we can go over that one next. So as I mentioned before, we do have the 3 annual max and then the 10 major medical, and we range in deductibles from $500 all the way up to that high deductible of $7,350. So showing a plan in the middle that is popular, our 2,500 and our 3,500 are our top 2. We can see the in-network and out-of-network deductibles, and then per family, max out-of-pockets as well. And we'll scroll down to the different copay sections. So this is a little bit different, okay? So again, not on that annual max plan, but on this major medical, maybe they have to go to their primary physician multiple times a year, okay? They need to go to urgent care multiple times. These do not have limits on them, but they do have various copays associated, again, with the different types of office visits and therapies. Same thing here, our telemedicine did just change to that $0 copay. So awesome for your member to not have to spend those extra dollars this year. If we scroll down to preventative services, again, we'll see those preventative services 100% covered for going to an in-network physician. They can go to an out-of-network on that major medical. They do have that out-of-network deductible that they would be working towards. Again, lists there of the preventative services that are covered underneath the plan. And then the physician services below, we can see 100%. They pay their copay, then are covered. And then if they go to that out of network, they have that 60/40 coverage there. If you scroll down, so diagnostics and so forth, again, we sell those. So a little bit different than the last plan. No limits. They will have their copay for, you know, going to see that physician or that office visit and so forth, and then covered 80% after their deductible. One of the key things here on our, I guess I should have pointed out on our annual max plans, let's say that they have to have multiple labs done or multiple different x-rays done, or it doesn't really matter. They are at the doctor, and so they pay that copay once, and all of those services are covered under that one time. Just because they have to go to lab and x-ray, they do not have to pay for those services and have to use 2 of their 10 visits for the year. We have our urgent care and emergency room and ambulance services, again, a little bit different, no limits here, just different coverages. Same thing with our inpatient hospital services, listed below, and then maternity as well as covered in this section. And then we have our different therapies that are covered, speech, cardiac, chiro, physical, and occupational. We have our mental health services, we have our substance abuse, and let's see what else we have. Again, different, a little bit different for the home health care. You can see home health care here, we have 60 visits per benefit period. Okay, so a little bit different than those annual max plans, a little bit more robust coverage. And again, these plans do require pre-certifications for the surgeries and the durable medical equipment and additional things. And then if we scroll down, we'll see the second pharmacy associated with our major medical plans, the 500 through the 5,000 HSA, they utilize MetalSRX formulary. So you can see the website, you can see the formulary there, and when you go through the formulary, you can actually see, if you scroll down a little bit more, Crystal, there are different co-payments depending on the tier of medication, and those are listed in the formulary. So are they a tier 1, tier 2, tier 3? Again, our specialty medications would need to go through that PAP or PIP program for assistance. But again, you can see the differences. They can do a mail order as well on any of our plans, but a little bit different than those annual max. And then if you scroll to the bottom, I believe, do we have our, okay, so you guys can see the age bands. So for a 2,500 plan, we have 3 different age bands. And again, that's for our 500 through our 7,350. They all follow these 3 age bands from ages 18 to 44, 45 through 54, and then 55 through 62. So looking at those prices there for the different tiers of coverage. And then the last plan we're going to go into is our HSAs. So we carry 3 HSAs. We carry a 2,500 HSA, a 3,500 HSA, and a 5,000 HSA. So some of you might be familiar with HSAs. Maybe you're a little bit newer to selling them. We just sell, or not really sell, we just have the 3 when we don't necessarily have the HSA account tied to them. So I know that is a big question a lot of individuals have, but the member can go ahead and get their own HSA account and open that up for those expenses. So again, we have our in-network, out-of-network, we have the family, we have the max out-of-pockets within those plan years. Again, scrolling down, HSA is a little bit different. So we have that 20% after deductible. Their telemedicine here, again, $0. So they would not be required to pay for that. And then scrolling down to preventative services. Again, preventative services are going to be covered 100% underneath these different types listed. And then for the complete list, you can see the 64 MEC there. As long as, again, they're going to that in-network. If they're out-of-network, going to pay a little bit more. We have our different for, I guess you could say in-network and out-of-network here for these sections for the physician services. And then again, this kind of repetitive, you guys just saw lab, x-ray, emergency. So a little bit of the coverage. If you want to keep scrolling, Crystal, all the way to kind of the bottom. You guys have now seen this for 3 times, the different highlights of the plan. And taking a look at the plan documents that we can and SBCs we can provide to you um, for these plans. Big thing here is, this is really a highlighted brochure. So taking a little bit deeper dive into the plans, what's covered, what's not covered, what's considered an exclusion for those, or will be able to be seen in those plan docs. Again, you can see the different age bands, the different tiers, how these are a little bit different than the annual max plans there. And then Crystal, if you can go to the 11 knockout questions, if you have them open there. Perfect. Okay, so in the beginning, we told you we have the different plans. They have to fit the age bands. They have to be a 1099, and then they have to go through these 11 knockout questions. So when you're doing an application with your member, okay, and their dependents, if they answer yes to any of these questions, then they will be unfortunately declined. Okay, you do not need to submit the application. I do know that some carriers say, hey, you need to still submit the application. We do not require you to, okay? But the questions do apply to anybody who is going to be applying for coverage. So if it's a family, it applies to everybody. If it's just a single individual, just that one. So we take a look at some of these. For example, the first one, are you under the care of a doctor currently or in the past 5 years for cancer, heart disease, heart attack, surgery, and stroke? Okay. Again, the next one, are you homebound, incapacitated, on self-support, and currently or in the last 5 years? So taking a look at some of these, when you're going through with your member and you have questions, okay, feel free to email into us or call into us and we can help you with maybe, if it's an underwriting question. Just trying to be as honest as you can with your member, and hey, do you have this medical condition? What are they telling you when you're going through the application? And then again, we can see here lupus, MS, so forth, Crohn's disease, do you have organ failure, an organ transplant? Number 5 is the big one. Are you or any of your dependents applying for coverage, currently pregnant or expecting? So we have had individuals email in that they unfortunately don't come on our plans because maybe the mother is pregnant or the spouse or whomever is pregnant. So that's a big question. And then number 6 with being hospitalized. So looking at that, that's a big one, okay? In the last 5 years, are you still being treated for an issue that you had to be hospitalized for, okay? So, is it medications? Is it still going to a rehab, a therapy? Were they in an accident? What was it potentially? We look at number 7 with respiratory disorders, number 5, musculoskeletal, and number 9 is where we get that substance abuse question. And then number 10 and 11, we look at number 10 is a big one. So a type 1 diabetic, okay? We will cover type 2s. However, we will not cover a type 1 diabetic. And then number 11, looking at the surgery, okay? Or anyone applying for coverage has had a surgery that they're still being treated for. So again, maybe they had surgery a year ago, they're still going to physical therapy once a month, every quarter. We would not accept them or have an upcoming planned surgery. Again, maybe they have surgery planned in a month, 3 months, 6 months. Unfortunately, we would not cover them. So those are the 11 questions that through the application portion, an individual will see. Let's kind of pause here if that's okay. I know we went through a lot of information on our plans and so forth, and we can run through maybe a brief thing of the application, but what questions you guys maybe have on the plan information or what we've shared so far?
I don't see any questions in the chat right now, so if anybody has any, please feel free to put them in there. I had a couple of questions.
Sure.
Going back, I think it's going to be everything, but particularly in the annual max. Is there a waiting period?
No, there is not a waiting period.
Okay, so they're perfectly fine, and then they're pregnant or they have a health condition that pops up in 30 days. There's no waiting period on that side of it for either of the plans, right?
Correct.
Perfect. I know that's a big one, so.
Sure, yep. And trying to see, think of some other frequent questions that we get. obviously who fits into the plan. We do get various underwriting questions. Sometimes you don't think about them and then you're in the field and you're like, okay, maybe somebody has something special or kind of outside the norms. Our plans are, for individuals who are primarily healthy that can, pass those underwriting questions. We do not at this time accept for we don't at this time accept for more information. So sometimes in some of the plans you might write or applications, there might be a note sections like, explaining maybe a medical condition. At this
Mhm.
time, we're pretty, it's a yes or no move on application for the time being too. So that's kind of a factor or a question that we get as well too.
Now,
Trying to
on
think.
the like type
Oh,
2 diabetes side, um, do you run into issues with insulins or diabetic medications in the formulary, or is it pretty broad?
I would say kind of it really depends. As we see that diabetes medications are growing or they're also being used for weight loss, trying to be
Mhm.
clear in what they're being utilized. Super important. I will say I do see a few more medications sometimes covered on the Medalist formulary for individuals with diabetes. Now they could be a type 2 and be on insulin and come on the plan.
Okay.
The other frequent question we get that is kind of in the next part of the application phase, though, is we always start our plans on the first of the month. So you can enroll members for the entire year of 2024. It doesn't have to just be during open enrollment period. We do take individuals this every single month. Their plans do start on the first. And when you are enrolling clients, we do have a 23rd of the month cutoff. So all applications, for example, for February 1st would have to be in by January 23rd for their coverage to start 7 days later. So during that period, again, I'm kind of jumping ahead here, Crystal. I'll let her explain a little bit more, but through the application phase, they're in by the 23rd. Then there's a wellness component where they get to have a dashboard with different wellness activities and so forth. But within that wellness component as well, or that dashboard, they have access to electronic documents like their ID card and so forth before their hard copies come in the mail. So typically, if you have a later enrollment on that after the 20th of the month, they're going to need their electronic card, or they're going to see that before their hard copy comes in the mail too. So kind of pointing some of those post documents out. Trying to see any miscellaneous. If you guys think of anything, feel free to drop it in the chat. But I'll let Crystal kind of take over. And Crystal, if you just want to do a brief overview of what the application kind of looks like, I will let you go ahead with that.
Screen again. Okay. So whenever an agent has logged in, this is going to be, their management site. It may look a little different, but pretty much this is what generally it will look like. They'll say, good afternoon, your information. This is going to give you your, each agent will have their own identifying enrollment site, and it will have their unique agent ID number. Also, I want to point out on the homepage, everyone has access to these videos. It will give, it's a short video of 2 to 3 minutes. It's going to walk you through the management site, an enrollment process, or instructions on how to add your licenses. In the event that someone needs help with that, these are really helpful and useful. We get a lot of questions regarding that. So let's go to the enrollment site. So on the enrollment site, you'll see all the listed products that you're actively able to sell. Under each portal tile, I'm sorry, you will be able to click on them and you'll get a little brief description of each of our products. And within this side of the information tab, you will be able to pull a full brochure if needed. You have the ability to view and share with your client the summary of benefits coverage based on this product. And more importantly, you definitely have the ability to do a provider search if needed. Down here are the instructions, but it's very simple. You're gonna click on the link. Minimize this because it looks a little funny on my side. I apologize. The bar is like right in my. So you're gonna click down here where it says provider. It's gonna give you a disclaimer. You're gonna click OK. Select your network. It's always gonna be PHCS. Then next, you're gonna click on practitioner and ancillary. And then down below, you have the ability to put in the facility. It'll give you popular options in the dropdown. You'll put in the client's zip code and then click on the search button. So a really easy tool. And in the event that they ask you during a live enrollment, you have the ability to walk through that process with your client to confirm that their doctors are in network if needed. And the pricing tab, since our metal plans are age band, you will be able to enter the client's date of birth, the primary. And if you click on view cost, it's going to give you the exact amount that your client would be expected to pay based on the benefit level that they're coming in. So whether employee, which is individual, an employee and spouse, employee and child plan, or a family plan. Under the states, I'm sorry.
So as far as the primary, are you able to choose the youngest if there's an age band situation, or who do you consider the primary?
So the primary is the person who is the 1099 business owner. So if that individual is the younger spouse, then that could be if let's say both, or let's say in a spouse they both are 1099 and one's younger, you could choose the younger one, as long as whoever the main account holder is does hold some sort of 1099 tax status, then they would be that main account person.
Okay. Perfect.
So under the states section, we're gonna see all the states that we are currently listed available to sell within the United States. There are some territories that are populated here, but we do not currently sell outside of the US. And here are the 6 states that we do not actively sell in, which is California, Hawaii, New Hampshire, Oregon, Vermont, and Washington. So once your client has chosen the product that they choose to enroll in, you'll be able to click on enroll. Be populated, sorry about that. Click on it again. This is what it should look like. It's going to show you in the cart the product that your client wishes to sell in the event, just given that you guys were able to see that, if you were ever on your enrollment site and working on a different application and you have not, completed that, it will populate in your cart until you either cancel it out by removing it or have completed it. Just a little reminder. So basically up here in the date of birth, you're going to put in the primary date of birth, put in a generic number, and make sure they're old enough. You're gonna click update as you show it's flashing once that demographic has been generated. And then as you see here in the active dates, based on our rules, our cutoff date is the 23rd of each month. If the client wants the following month's effective first, the first of the month date. In the event that you are making an application after the 23rd of January, for an example, it's going to only show you March 1st. But currently, since we're within the enrollment period, you have the ability to choose either or, whether February 1st or March 1st. We'll just keep it for February. And down here, you have the ability to go ahead and populate what benefit level that the enrollee is coming in on. You're gonna click on continue. And this is the application. You're going to go ahead and generate the client's information, all of their demographics. You'll enter all this. You will put in their contact information, their social security, their date of birth would already be populated, and their gender at birth. Down below are the 11 knockout questions. As Amanda stated below, you know, these questions do need to be answered truthfully, and they will have to answer no. At any given point, if the client or anyone that is applying within this application, like their dependents, answer yes to any of these questions, you do not have to continue with the application. You can just go ahead and cancel. Once all these questions have been answered, down below you have an agent authorization. This is where the agent that is creating the application will go ahead and type their name. Down below, you will enter in their credit card method. And more importantly, as it is described here, if they are using or wish to use a credit card, you know, please advise that there is a 3% credit card fee each time that credit card is used. We currently are only accepting Visa and MasterCard. If they do choose to use an ACH draft, it is at no cost to the client. And the first payment is received at the moment that the application is submitted. That's another important detail. And so, like, for an example, if their application is going to in effect for March 1st, they will pay their first month's premium the moment that the application is submitted, and then their next bill date will be on the 20th of March. Down below, you're going to click this by authorizing that you've entered everything as truthfully as possible. And then here are where the signature links will be sent to the client. You will pick either or, so whether they want to receive a text via their smartphone or if they wish to receive it via email. Once the client has chosen which form they would like to receive, you'll just simply click on send. And we have this question a lot of times where agents are stating that it's taking a little bit long. If it is sent via text, sometimes we have seen that if the client does not have good reception, or if the client, depending on their phone carrier, the text message may take a little bit longer. Just some tidbits that we've picked up along the way. Usually within 5 minutes, the client should actually receive the link, whichever way that they have chosen. In that event, if they have not received it and there is an issue at that point, once you've pushed out the link, a little box would appear here, and you will have the ability to cancel that link and resend a different one if needed. Any questions on the enrollment portion?
No, does not look like we have any questions on that.
Okay.
We did have one that came up and it was Amanda answered it, but it was regarding the provider searches. If you go in to search the doctors, are you just clicking on the practitioner and ancillary? So in that case, yes, you would click on find a provider and then do the selected network with the PHCS and practitioner and ancillary. Then you'll enter in what kind of physician you want to see in their zip code. So I think the practitioner and ancillary is going to cover everything, right, Amanda? It'll cover if they're seeing, if they're going to an urgent care or a lab or a hospital, everything would pop up in that, right?
The big thing here, just so you guys are aware of, so there'll be urgent care physicians and stuff. The only thing it won't have on there is per se a hospital. PHCS doesn't list their hospitals for RVP. So again, if they're going to a hospital for a pre-certification, we would let you know where you're going to be going there. Now, let's say your doctor maybe works in a hospital. The big thing there is that you're searching for the physician. Okay, don't just search the hospital wide, search for the physician that you're going to go see and then their specialty.
Okay. So like where I live, most of the doctors are tied to a hospital or tied to the hospital, but you'll have them listed under their provider name, not under the
Yep, they would
hospital
be.
name.
Yep, if they were, if they're in that network, then they will be. Yep.
Perfect.
Some other questions that sometimes we get from agents as well is, for example, is there, a rate increase or so forth? So when your member comes on the plan, they will not see a rate increase, possibly. Let's say it depends on renewal. Okay, maybe they see it at renewal, maybe they don't, but they do have that rate for their plan year. So that's super important to know that they won't just be in the plan and then 2 months later see an increase. So they are guaranteed to have that rate for 12 months coming into the plan there. Another question we get a lot of times is, do you guys have standalone RX plans for maybe additional medications? At this time, we do not. We don't have additional standalone RX plans. Let's see what other kind of questions we get. We went over the draft again, no waiting period. The individuals do have a free look period, so they do have a 10-day free look period. Let's say they want to change their plan or cancel it before it goes into effect. They have that ability as well too. And then the only other key component here is, for example, for pre-certifications, let's say there's a claim that needs to be submitted or qualifying life event to add somebody or take somebody off their plan. We do have our care guide advocates that can assist with some of those plan changes that are being needed. So we do have resources that tell you who to call and to utilize when your clients need specific services or maybe help with their plan or explanations as well too.
Okay. And those advocates help, I know like with the hospitals, revenue-based pricing, right? So when you get the pre-cert, you call into the advocates, they help you find the provider in the area that is
Yep.
going to be the most cost efficient, I think is the right word.
Yes.
But then they also help, like on the medication side, you were just talking about, there's not a standalone, but they help them with patient assistance programs.
Correct.
And the other one you had mentioned. So I know on our side, if we're dealing with Medicare or whatever, we're often that person who's looking up the patient assistance programs for them. But in this case, we would just direct them to the advocate to assist them with that, right?
Yeah, so making sure, before you enroll that individual, looking at their doctors, we stress this big time, look at their doctors and look at their medications to see, which plan might be the best fit. And then if they do need that additional help or medication coverage, then we'll go through that PAP and PIP to try and assist them.
Wonderful.
If you guys have any additional questions or we hop off, feel free to email. Let me just drop our email into the chat here. And then that way you guys we can get your questions answered.
You can also reach out to me and I can get the questions answered for you if you
Yes, please.
don't get a chance to write
Please
that down.
reach out to you first and then send it to us. Or CC everybody in
We're
the
certainly
email.
happy to help too.
Yes,
All
of
right.
course. But I think that might be it, everybody.
I do. I don't see any other questions. So thank you so much, everyone, for attending today. If you are interested in contracting, please let me know. I'll also reach out to everyone who's attended and see if there's any other follow-up questions or anything that we can assist you with. And again, thank you so much. Everybody stay warm or dry, depending on where you're at, and have a great rest of your day.
Thank you.
Thank you. Bye-bye.
Thanks, everyone.